Root canal therapy is a standard dental procedure performed to preserve a tooth which is severely damaged or affected. It involves taking out the damaged or infected pulp from inside the tooth, then cleaning and disinfecting the canals and sealing the tooth to stop any further infections. Although root canal treatments are usually successful in saving a tooth, there are many who wonder how effective the procedure is actually. As per the American Association of Endodontists, the rate of success for root canal treatments is usually extremely high, with as much as up to 95% of cases having been successfully completed. That means in the majority of instances, the tooth that is treated with root canal is saved and will remain functioning normally throughout the years ahead. Many factors could affect the effectiveness of root canal treatments. One of the main aspects is the expertise of the dentist who performs the procedure. Root canal treatments are an intricate and delicate procedure which requires precision and experience for a positive result. It is therefore crucial to select a skilled endodontist for the root canal procedure. A third factor that could influence the rate of success for root canal therapy is the severity of the injury or infection to the tooth. If the condition is serious or dental damage is severe, the success rate of treatment may be less. In such cases, further treatment or procedures could be required to preserve the tooth. It's also crucial that patients follow the instructions of their dentist following treatment so that they can maximize the effectiveness of the root canal therapy. It could include following the prescription antibiotics, not consuming certain food items or activities, following up appointments when they are scheduled. If they follow these guidelines, patients will be able to make sure that they are successful in the root canal procedure. In certain instances, the root canal procedure may not work and the tooth might require extraction. It can be due to various reasons, like a new infection developing within the tooth or a broken tooth that is not repaired and a failure to adequately seal the tooth following the treatment. When this happens, extraction could be required to avoid future complications and to protect the health of surrounding gums and teeth. The overall success rate of treatment for root canals is extremely impressive, with as high as 90% of patients having a positive outcome. If you choose a qualified and experienced dentist, observing the instructions for post-treatment carefully and taking care to address any other problems promptly, patients will increase the odds of getting a positive outcome. If you're in need of a root canal procedure, make sure you consult an experienced and reputable endodontist for a discussion of your choices and to ensure you get the best result for your oral health.